Hello, and welcome to the 6th episode in the Tower Health COVID-19 podcast series. I'm your host, Therese, Chief Operating Officer at Tower Health and Interim President and CEO at Reading Hospital. Today, we are going to be discussing the very important topic of the COVID-19 vaccine for women of childbearing age and pregnant women. Joining me today are two very talented OBGYNs from the Tower Health team, Dr. Mark Woodland, Chair, Department of Obstetrics and Gynecology at Reading Hospital, and Dr. Carlene Denis, Phoenixville Hospital Medical Staff President-elect and OBGYN with Axia Women's Health, Valley Forge. Welcome, Dr. Woodland and Dr. Denis. Thank you for your time today.
Thank you, Therese.
Thanks for having me.
Sure. Dr. Denis, I know patients have asked you and your colleagues a lot of very important questions regarding the COVID-19 vaccine. So we're going to address some of those questions today. First, one concern many women of childbearing age have regarding the vaccine is that it may affect their fertility. Can you tell us what the data has shown at this time around this particular issue?
Absolutely. There has been absolutely no evidence that any vaccine, including the COVID-19 vaccine, has caused any fertility issues in either men or women. Their current data is included in their V-Safe monitoring system with the CDC, and there's over 160,000 pregnancies that have been registered, including thousands of pregnancies that were actually registered from the clinical trials that started back in 2019.
Thank you, Dr. Denis. That's very, very helpful. Dr. Woodland, this is a big question, but I think it's an important one for our listeners. Can you tell us why it's so important for pregnant women to receive the COVID-19 vaccine?
Yeah, thanks. That is a really important question. First of all, vaccine is so much safer than disease in pregnancy from what we've experienced in our own populations. It's important to know that both the American College of OBGYN, which is our leader organization, as well as the Society for Maternal Fetal Medicine, have recommended vaccine for pregnant women, as well as the American Society for Reproductive Medicine has recommended vaccine for women before they get pregnant to help lessen the effect of the COVID burden on the pregnancies. A vaccine protects the mom and also the antibodies crossing the placenta protect the baby from COVID. And this really decreases not only the risk of disease in mom, but disease of the placenta that can affect the baby and any potential infection to the baby. Pregnant women are at increased risk for serious disease and death. In the country so far, there's been 161 deaths of pregnant women, but that doesn't count the adverse outcomes of the pregnancies that have been infected by COVID as well. And we've certainly seen them. I know Dr. Denis and I have seen these at both of our institutions, which has been really traumatic, not only for the families and their loved ones, but also for the staff that provide care for them.
Thank you, Dr. Woodland. Dr. Denis, can you please tell us more about the benefits for the baby if an expectant mother receives the vaccine? And could you also share the benefits for the baby of breastfeeding mothers who receive the vaccine?
So being vaccinated during pregnancy allows the mother to start creating antibodies to COVID-19. That does cross the placenta and does provide some protection to the baby. And the same way breastfeeding gives those same antibodies to that baby. Babies can't get vaccinated. And so mom really is the only one that can protect them when something like this is happening. And we've been advocating for vaccines in pregnancies for decades, and COVID-19 is just being added to that list.
Thank you. I have a follow-up question for you. If COVID-19 antibodies can be passed through the breast milk, does that mean that COVID-19 virus can be passed through the breast milk as well?
That is a good question. And I've actually gotten that question quite a bit in the office when I'm seeing patients. So there's currently no evidence that the actual virus passes through breast milk, even though the antibodies do when you are protected against COVID-19. However, it's a respiratory virus. So when mom is breastfeeding or bonding or even bottle feeding, being that close to baby is what really passes the virus to baby if mom is positive at that time.
Thank you. Dr. Woodland, you mentioned something earlier that I'd like to come back to and discuss. You stated that pregnant women are at an increased risk for serious disease and hospitalization if they contract COVID-19. Can you tell us more about that?
Sure, and I want to really highlight that we've seen a lot of this during the pandemic that has really not only strained us as providers, but also strained our institutions. But pregnant women are at increased risk for severe illness compared to those that are not pregnant. And this could include not only hospitalization, but also admission to the ICU or special equipment to help both, like ventilators. We've had many patients who are pregnant with COVID having to be on ventilators. This has also resulted in preterm deliveries and some adverse outcomes for the neonates as well, which is really tragic when you think about the fact that this could be avoided simply by vaccine.
And as a follow-up to that, Dr. Woodland, if a pregnant woman decides to receive the vaccine, when in her pregnancy should she receive it to provide maximum benefit to the baby?
So that's sort of a trick question, Therese, because I'm going to say any time during the pregnancy is better than no time during the pregnancy.
That's fine.
And actually, I would even say before pregnancy or after a pregnancy as well. So if for any reason a woman is really concerned they're in the last trimester of their pregnancy, I would say if they are resistant or hesitant to getting the vaccine at that point, then get it postpartum. Get it postpartum so that they can help protect themselves as they go through the postpartum period. I know at Reading Hospital, we have a postpartum vaccination program that has been really something that we started a while ago and has been heralded by the state to be a signature program for access to vaccine. I don't know if Dr. Denis wants to comment on that too.
Absolutely. We've actually been doing it at Phoenixville Hospital as well. And we're definitely seeing many, many more women being open to being vaccinated once they've delivered. Some of that hesitancy and fear and concern really does dissipate a little bit once they have delivered. You know, pregnancy is such a vulnerable state already for every birthing person. So this has just added on top of that. So at least being able to offer it postpartum has made a lot more people comfortable with having that kind of access.
Thank you. That's very helpful. And I want to thank you both for joining me today. I'm so appreciative of the work you and your colleagues have been doing to help our community during this pandemic. Before we end our discussion, is there anything else that you would like to add? Dr. Denis, I'll start with you.
I will try to be not emotional when I say this part, but you know, giving birth, pregnancy is such a vulnerable state. And this pandemic has just added so much to everyone's level of anxiety and fear and concern at an already stressful time of any birthing person's lifespan. So I think it's even more important now to find a birth provider who will really listen to you, hear your concerns, and be able to give you really good information that vaccination is safe. And we are wholeheartedly on board with people getting vaccinated during their pregnancies.
Thank you very much. That's very important information. Dr. Woodland, I'll leave it to you.
Well, thank you. First of all, thank you for doing this this short piece, and I really support all the comments we've made. And you know, like Carlene, I'll get a bit emotional too, because as OBGYNs, we are emotional people because of what we do, and our relational skills with our patients is so important. One of the things that we know is that we're here as providers of care for women, and we wouldn't do anything that would adversely affect a woman during her pregnancy or for her postpartum care or even before her pregnancy. In fact, we only do everything to try to support those causes. Vaccine and vaccine hesitancy are things that we've talked about so much, but the reality is the vaccine is such an important tool that we have right now to really put the COVID virus back in its box for now and protect women and protect their unborn child. So I really appreciate the fact that you did this. I really appreciate the time to talk with you and with Dr. Denis as we've had a nice reunion here about this virus and the vaccine. Thank you.
Thank you both very much. I really appreciate your time today because this is a very important topic for women, for everybody really throughout our community. I want to thank all of you as well for listening. As always, if you have additional questions regarding COVID-19, please visit towerhealth.org/COVID-19. As always, be well and be vaccinated.